11:38 this morning, keeping your family healthy with coronavirus making headlines. A reminder that the flu is still widespread in nearly every state in the U.S. So when is it time to take your child to the doctor? In today's Your Health Matters, we got answers from a doctor with Overland Park Regional Medical Center's pediatric emergency room.
Usually they say about 3 feet is a contagion zone. So if you've got, a 2-year-old kid or, a toddler who's school-aged who is then coming home and kissing on the infant, it's best to keep them separate. So different rooms are at least 3 feet away then.
From sledding mishaps to respiratory infections, pediatric emergency medicine specialist Dr. Adam Gabriel Schiffman says his ER has been busy. Schiffman says he is seeing a lot of cases of RSV, a kind of common cold that can hit the youngest of us the hardest, landing infants in the hospital. We asked what symptoms should alert parents to take their kids to the doctor.
With RSV, especially in the young ones, they may have difficulty breathing. And so if any kid is looking like they're having struggling to breathe, if their respiratory rate is over 60 breaths a minute, and you can tell that if their belly is going faster than their second hand is ticking on their watch, that's too fast. They have any color change, some blue or purple to their face, if they look distressed, those are definitely concerns that they have to be seen emergently.
And we asked what signs of a fever warrant a trip to the doctor for your child.
So there is no too high of a fever because your body's doing it by itself, so that's okay. It's how long the fever goes is more concerning. Most viruses last about 5 to 7 days. So if you're having any fever, whether it be 100.4 or 104 for greater than 5 days, they should be seen by someone in the medical field.
But when is it serious enough to seek medical help? Schiffman says parents should trust their gut and don't be afraid to bring them in.
If they think that something is not normal, if something looks more severe than what they're comfortable with, then I'm never going to tell a parent not to come to the emergency department. If they're concerned, they should come. If there's any, in terms of head injuries, if there's any loss of consciousness, not acting appropriately so they have an altered mental state, or if they're having persistent vomiting, all those are concerns for head injury, and those should be seen emergently.
And it's still not too late to get your flu shot. Also, HCA's Care Navigator allows patients to meet with a doctor virtually. You'll find that at hcamidwest.com.